What is Velcade used for? Velcade, bortezomib, is approved for the treatment of patients with multiple myeloma, a cancer of the plasma cells. How is Velcade administered? Velcade is prescribed by a physician experienced in the use of medications to treat cancer. It is administered as an injection into your vein, IV, by a healthcare professional. Who should not receive Velcade? Before you receive treatment with Velcade, tell your doctor about all of your medical conditions. You should not receive Velcade if you are allergic to bortezomib, boron, or mannitol, pregnant or plan to become pregnant, breastfeeding. Discuss with your doctor when it is safe to restart breastfeeding after finishing your treatment. The effects of Velcade in children have not been evaluated. What are the possible side effects of Velcade? Velcade can cause serious side effects, including neutropenia, low levels of neutrophils, a type of white blood cell, and thrombocytopenia, low levels of platelets. Velcade can cause low levels of white blood cells, infection-fighting cells, and/or platelets, clot-forming cells. You will have regular blood tests to check your cell counts during your treatment with Velcade. If the number of these cells is very low, your doctor may change the dose and/or schedule of Velcade. If your white blood cells become low, you can be at higher risk for infections. Tell your doctor if you develop a fever or believe you have an infection. If platelets become very low, there is an increased risk of bleeding. Your doctor may recommend a platelet transfusion. There have been cases of bleeding in the stomach, bowels, and brain during treatment with Velcade. Gastrointestinal problems. Velcade treatment can cause nausea, vomiting, diarrhea, and constipation. If your symptoms are severe, your doctor may recommend IV fluids and/or medications. Peripheral neuropathy. Velcade can cause damage to the nerves, a condition called peripheral neuropathy. You may feel muscle weakness, tingling, burning, pain, and loss of feeling in your hands and feet, any of which can be severe. Tell your doctor if you notice any of these symptoms. Your doctor may change the dose and/or schedule of Velcade or stop it altogether. Low blood pressure. Velcade can cause a drop in blood pressure. Tell your doctor if you have low blood pressure, feel dizzy, or feel as though you might faint. If you are taking drugs that lower blood pressure, your medications might need to be adjusted. If you are not drinking enough liquids, your doctor may need to administer IV fluids. Heart problems. Velcade treatment can cause or worsen heart rhythm problems and heart failure. Your doctor may closely monitor you if you have or are at risk for heart disease. Tell your doctor if you experience chest pressure or pain, palpitations, swelling of your ankles or feet, or shortness of breath. Lung disorders. There have been reports of lung disorders in patients receiving Velcade. Some of these events have been fatal. Tell your doctor if you experience any cough, shortness of breath, wheezing, or difficulty breathing. Liver disease. If you have liver problems, it can be harder for your body to get rid of Velcade. Velcade has caused sudden liver failure in patients who were taking many medications or had other serious medical conditions. Symptoms of liver problems include a yellow discoloration of the eyes and skin, jaundice, and changes in liver enzymes measured in blood tests. Your doctor will closely monitor you if you have liver disease. Tumor lysis syndrome, TLS. TLS can occur with cancer treatments, and your doctor will be monitoring blood and urine for any signs of this syndrome. If you develop TLS, your doctor will take appropriate steps to treat it. Reversible posterior leukoencephalopathy syndrome, RPLS. There have been reports of a rare reversible condition involving the brain called RPLS in patients treated with Velcade. Patients with RPLS can have seizures, high blood pressure, headaches, tiredness, confusion, blindness, or other vision problems. Velcade treatment should be stopped in cases of RPLS. The most common side effects seen in patients receiving Velcade include thrombocytopenia, neutropenia, nausea, peripheral neuropathy, neuralgia, nerve pain, pyrexia, high temperature, diarrhea, anemia, leukopenia, low levels of white blood cells, decreased appetite, fatigue, constipation, vomiting, dehydration, dyspnea, difficulty breathing, cough, asthenia, low energy, insomnia, trouble sleeping, peripheral edema, swelling of the limbs, and headache. What other information should you discuss with your doctor? You should also tell your doctor if you have kidney disease. If you are on dialysis, your doctor will administer Velcade after the dialysis procedure. Are taking medication for diabetes? Velcade can affect your blood glucose levels. Your doctor may require close monitoring of your blood glucose levels and change the dose of your diabetes medicine while you are being treated with Velcade. Are using medicines like ketoconazole, an antifungal, and ritonavir, an antiviral, which will require close monitoring during treatment with Velcade. Are using any other medications, including over-the-counter drugs, herbal or dietary supplements, or holistic treatments. Develop a rash of any type while receiving Velcade. The side effects of Velcade may impair your ability to drive or operate machinery. These are not all of the possible side effects with Velcade. It is important to always contact your doctor if you experience any side effects while on Velcade. If you have any questions about Velcade, contact your doctor. Additional information is available on the Velcade website at www.velcade.com. Please see the full prescribing information for Velcade, including warnings and precautions.